Thanks for staying with the Pulse today. Questions have been raised about a batch of Cuban doctors trained who have arrived in South Africa to help fight the COVID-19 pandemic. People are concerned about how this will be funded, what will happen to unemployed South African doctors, and if all alternatives were explored. Dr. Koot Kotze is a South African doctor studying at Oxford in the UK. He's also a contributor to Bhekisisa Centre for Health Journalism. Let's get you more from him on this particular issue. Good evening, and thank you so much for your time tonight, Dr. Kotze. Firstly, you've been exploring the different ways that South Africa could be increasing the number of health workers, not necessarily lambasting the move to bring in the Cuban doctors. But speak to us about that dynamic. What were the options that could have been explored before we went abroad?
Thanks for having me on, Kathy. There are several different options that we could explore in this arena, and to be honest, every little bit helps. It's fantastic and it's very magnanimous of Cuba to be sending healthcare workers to South Africa. But like I pointed out in an earlier article for Bhekisisa, there are numerous options we could explore within South Africa to strengthen our health workforce. Part of that could be looking at foreign medical graduates that are currently in South Africa, and that comprises several different groups. And those are people who've done medical school abroad but don't have much clinical experience. It might also be people that have specialized in other countries and have significant clinical experience to contribute to the South African health response. According to one BMJ article, there are up to 8,000 foreign medical graduates in South Africa. And those are people that we could be looking towards to help in various different ways in the health response. Not necessarily by registering them fully as medical practitioners for independent practice, but we could be looking towards the United Kingdom as a potential option where they've allowed foreign medical graduates to register as acute care assistants to work alongside UK doctors under supervision to make sure that they adapt well to the local setting. And that's only one option we could be looking at.
PHPSI seems to have already responded to that particular issue. It doesn't look like they're going to be issuing any of the temporary registrations as we've seen in the United Kingdom. What then are the other options that government can be exploring?
I think it's a very, very difficult space to be operating in, particularly because there's so much uncertainty. I think there are different risk appetites in terms of approaching different options. The HPCSA is a difficult task in terms of having to be proactive in securing our health workforce that will be able to respond to the COVID crisis, even when a significant amount of our health workers might be taken ill with COVID disease. And that's really the scenario we should be keeping in mind when we plan for these things, is that what do we do when a significant amount of our healthcare workers are already ill? Are we tapping into all the expertise that we have available locally? And that might mean looking towards the foreign medical graduates or foreign healthcare practitioners that are currently in the country, or it might be extending a further request for help to other countries. The HPCSA's policy on this is understandable given the complexities of registering foreign medical graduates in the country, but we hope that they would look at the situation as it evolves and respond dynamically to the need that we have for people to help on the ground with the COVID response.
You've also spoken about how telemedicine could be used more innovatively during this pandemic. We, of course, we know that when it comes to psychiatrists and psychologists, there has been an exception made where they can have consultations over the phone, but that's if you already have an existing relationship with those clients. So in the current setup, where there would be many patients that are new to these doctors that they wouldn't have necessarily had any prior rapport, how would telemedicine be used in this instance?
Yes, that's a very good question. The opportunities to use telemedicine are immense, and we could be doing a lot more to tap into that in South Africa. The HPCSA has previously been very restrictive on the use of telemedicine, and they've justified that by saying that an essential part of a medical consultation or a healthcare consultation is the physical examination. But what we've seen in countries like the United Kingdom, China, and the United States is that we need to move away from doing absolutely everything we can to maintain a certain type of consultation, the type that everyone knows where you go to your GP and you have them take your history and then they examine you and do tests, to a community-oriented one where we use telemedicine to reduce the risk both to patients but also to practitioners. If we expect everyone who's feeling ill to come to healthcare facilities, we'll essentially be expecting both those that are extremely vulnerable to contracting COVID disease to come to healthcare facilities and potentially be exposed to the virus, and also those that might have a mild version of the disease who might have been able to safely isolate at home. They'll have to come to healthcare facilities as well. And as we know, people spread COVID disease without knowing it, without being severely ill. Another option to use telemedicine would be healthcare workers, doctors or nurses or pharmacists who are self-isolating or in quarantine but might be well enough to work. They'll be able to contribute to the COVID response from home without putting anyone at risk and contributing to the COVID response and reducing the burden on their colleagues in healthcare facilities. So there are very, very numerous benefits to using telemedicine. There are also risks in that the physical examination and some monitoring tests and vital statistics you won't be able to take as readily. But that's not a barrier to using this at all. And I think in this setting where COVID threatens both healthcare workers, other patients, and patients themselves, it's really something we should be exploring very proactively.
All right.
The HPCSA has made some changes in this, and we look forward to more to respond to the COVID response.
All right, Dr. Kotze, let's leave it there for this afternoon. And, of course, he's a contributor to the Bhekisisa Centre for Health Journalism.